Chapter 5, Cultural Implications. So what is considered a mental illness and how it is treated is culturally based. Not all racial, ethnic, or cultural groups have the same beliefs, even if they live within the same region. And how society views mental health plays a role in funding and resources allocated for treatment. Society and culture also influence an individual's beliefs on accessing treatment. There's a huge stigma there. So all nurses, including psychiatric nurses, must adapt assessments and interventions to each patient's cultural needs and their preferences. So minorities are racially, ethnically, or culturally distinct groups that coexist but are subordinate in some way to a dominant group. Minority status, not always fewer in numbers, but lacking political and social power. They may be treated differently and discriminated against. So this includes women, disabled individuals, gender, sexual minorities, as well as political minorities. Race can be defined biologically, anthropologically, or genetically, can be distinguished visually from one another based on physical characteristics. Ethnicity, this is common heritage and history. They share a world view. And culture, these are shared beliefs, values, and practices. Cultural norms are attitudes and behaviors that are deemed normal or average in a group. So measuring race and ethnicity in the United States, the U.S. Census Bureau combined race and ethnicity into a categorization system. The purpose is racial ethnic descriptions help the government understand the needs of its citizens. The census helps to identify disparities in healthcare along racial ethnic lines. So in 2045, the U.S. population is projected for the first time to become a majority-minority nation. No one group will make up the majority or make up 51% of the population. You can look at Table 5.1 on page 80 for the 2060 projections. So let's talk briefly about Western tradition versus Eastern tradition. Western tradition refers to North and South America, Europe, Australia, and New Zealand. In Western tradition, the identity is found in the individuality. We value autonomy, independence, and self-reliance. The mind and the body are considered separate entities. We believe that disease has a cause and treatment is aimed at the cause of the disease. We believe that time is linear and that its success is obtained by preparing for the future. Eastern tradition refers to nations in Asia and the Middle East. The main difference is that culture in the East is more conservative and traditional than the general population in Western culture. Eastern tradition, family is the basis for their identity. Body, mind, and spirit are one entity. Time is circular and it recurs. You are born into fate and it is your duty to comply. Disease is caused by fluctuations in opposing forces. The book gives an example of the born into fate. It said if a child is born mentally ill, they may be viewed as a punishment for one's behavior in a past life. So indigenous culture refers to the native people that have inhabited an area. It places significance on place of humans in a natural world, and the basis of identity is the tribe, not on self. The person is an entity only in relation to others. The body, mind, spirit is as one and may not have words to describe as separate entities. And as far as disease, there's a lack of harmony, or they believe there's a lack of harmony between the person and the environment when they have diseases. Table 5.2 on page 81 gives you worldview comparisons. So Mr. H lives with his daughter, who has become concerned about his memory. Sometimes he says he's going out to garden, but then he just disappears. Yesterday I was frantic. Then a neighbor brought him home from the shops nearly half a mile away. When I said, "Dad, where were you trying to go?" He said, "I don't know. Did I get there?" Sometimes I think he believes he is back in Mumbai. Although his daughter has been here almost 15 years, Mr. H is a fairly new immigrant. He speaks some English and is highly educated. His daughter has mentioned he is from Mumbai in India. Which attitude would you expect him to share? B. Disease is part of one's fate and we have a duty to comply. Which worldview would the nurse anticipate from a client who says, "It is important to save enough money to take care of yourself in your old age. We should not rely on anyone else to take care of us"? B. Western. So culture changes and adapts through the influences of the outside world. It is not static and it is not fixed. Nonverbal communication plays a large role in how things are perceived. For example, eye contact in our country is a sign of respect, but in other cultures it is a sign of disrespect or even arrogance. In some cultures, an outward expression of emotion is seen as immature. You can see table 5.3 for selected nonverbal communication patterns. Etiquette is what is considered polite behavior. What are considered etiquette norms for one culture may be different from another culture. And this is norms of etiquette on box 5.1. Beliefs and values. Dominant American beliefs and values are often starkly different from other cultures. And you can see this in table 5.4. So there are some terms that we need to go over. The first one is enculturation, and this is the process through which we learn about our culture. And the next one is ethnocentrism. It is the belief that an individual's way of thinking and behavior is the only correct way. So let's talk about cultural barriers to mental health. There are communication barriers. Clear and effective communication is key to providing best patient care. Language barriers can cause difficulty, so professional interpreters must be used. Avoid using the patient's relatives or friends if at all possible. A professional interpreter will be most effective when they can interpret both language and culture. Match the interpreter as closely as possible in gender, age, social status, and religion. Also provide written materials in their native language, and you may need to use visual aids to facilitate understanding and reinforce communication. You should ensure that material is written at a 6th grade level or lower, and you should provide a variety of education materials. So the stigma of mental illness. Individuals may delay seeking help or not seek help at all due to the stigma of being viewed as weak or dangerous. Some cultures believe that a person with a mental illness is shameful and a failure of their family. Misdiagnosis. Certain cultures describe mental illness differently, as in physiological symptoms, and never mention the emotional or mental symptoms. Somatization. is when the patient experiences physical problems due to a mental illness. The available assessment tools are usually geared toward those of Western culture as well. The DSM-5 now includes a cultural formulation interview to determine the patient's cultural views and beliefs. Cultural concepts of distress is how a certain group experiences, understands, and communicates problems, thoughts, or emotions. There are 3 different types. You have idioms, explanations, and syndromes. Cultural idioms are ways of expressing thoughts or feelings that only those in the culture would understand. For example, I am a nervous wreck. Everyone in this room probably knows what I mean, but if I were to go say that, say in Japan, they may not understand that. Cultural explanations. These are perceived causes that seem to explain the symptoms or illness within that culture. For example, some may believe that having seizures mean they are demon possessed. And then cultural syndromes. These are symptoms that are common in some cultures but non-existent in others. And on page 85, box 5.2, gives you some examples of this. And then generic variation in pharmacodynamics. This is how the action and side effects of drugs vary due to genetics. So let's talk about pharmacogenetics. This is most clinical trials involve a high percentage of Caucasian participants, so research is limited in other cultures. This field focuses on how different genes respond to medications and enable clinicians to determine the correct drug and the correct dose for a patient. So special populations at risk. So non-dominant cultures experience challenges in ways the majority group do not face. Immigrants. These people voluntarily choose to relocate and need to learn a new language as well as economic, political, legal, educational, transportation, and healthcare systems. Generally, the new culture is valued and there is a change in circumstances. This is a process called acculturation. Assimilation is when an immigrant embraces the new culture and becomes more natural than other immigrants that relocated at the same time. Children tend to assimilate rapidly, whereas adults tend to hold on to their past values and beliefs. Refugees are different from immigrants in that they flee their homeland in an effort to escape unbearable conditions. This is not an active choice, so adjustment to new culture may be difficult. They may also experience trauma and loss, which can lead to PTSD or major depressive disorder. In poverty, this is exposed to bias, discrimination, and racism. These people may have limited opportunities for education and jobs, and they have a higher incidence of mental health illness related to poverty, not race, and it's not related to ethnicity. So culturally congruent care is applying evidence-based care that corresponds with the patient's beliefs and values. Cultural competence is the process of demonstrating culturally congruent care in attitudes and behaviors of the nurse. And there are 5 constructs to becoming culturally competent. When we are assessing our cultural competence, as a nurse, we need to assess the clients and make care decisions based on their culture, rather based on their race or ethnicity. If a patient is comfortable, they are more likely to seek treatment. There is a model here called the Campina-Baycoat model. Is a process of cultural competence in the delivery of healthcare services. So nurses view themselves as becoming culturally competent rather than being culturally competent. So you see yourself as a learner throughout your career. This specific model can help you identify strategies that fit within the cultural context of your patient. So I want to talk about the different definitions. Cultural awareness. So through awareness, we can realize that culture has a huge impact on a patient's health values and practice. Culture actually helps a patient decide when they are ill and what treatments they will seek. And as a nurse, we need to determine and examine our own cultural awareness. Some examples of cultural awareness. African Americans or Caribbean cultures may have a fatalistic attitude about illness, and they may believe they are being punished for wrongdoing or are victims of witchcraft or voodoo. They may actually be reticent to share information about curses with their therapist, and they may be misdiagnosed with schizophrenia when in fact they're simply depressed. Cultural knowledge can help nurses understand behaviors that might be misinterpreted. And you can read these bullet points. Cultural encounters occur when we directly engage in interactions with patients from culturally diverse backgrounds. Cultural skill is the ability to perform a cultural assessment in a sensitive way. You should be familiar with all these bullet points. So let's talk a little bit more about cultural skill. In those bullet points that I said you should read, you need to ask these questions because it helps with cultural sensitivity, but these questions, ask them as a conversation instead of directly asking them. Allow when practical special cultural practices, like they may want to eat certain foods, they may need folk remedies or healers, allow them to come in. But if you find that cultural patterns are harmful, you need to attempt to repattern and restructure this person. For example, when those herbal medications will interact with their prescription medications. An example of cultural skill, Native Americans may suffer from low self-esteem due to difficulties blending both American and Native American worldviews. So skillfully helping them navigate that. Asian cultures consider dietary change to include either hot or cold foods, but it does not refer to the food temperature. It refers to correcting energy imbalances for healing. And your indigenous cultures may suggest rituals for healing. Then your Mexican Americans, they express heritage through language, works of art, music, dance, customs, traditions, diet, and their spirituality. And then finally, cultural desire. It indicates that the nurse is not acting from a sincere and genuine concern for the patient's welfare. So you should demonstrate genuine concern for your patient's welfare, a willingness to listen until their viewpoint is understood, and a sense of empathy. Cultural desire equals openness and flexibility. And the knowledge check. Which term refers to individual beliefs that their cultural values and practices are correct and superior to those of others? C. Ethnocentrism.